Hi, everyone. Thank you for joining us. I'm Rebecca McGrath, Senior Vice President of Government Relations for Cardinal Health. First, I'd like to thank you for taking some time to chat with me today, Linda. We greatly value our partnership with you and HIDA, and your expertise and thought leadership are critical as we are all navigating this incredibly challenging time. Could you take a moment and introduce yourself and your role at HIDA?
Absolutely, and thanks so much for having me today. As Rebecca said, I'm Linda Rouse O'Neill. I'm the Vice President of Supply Chain Policy and Executive Branch Relations at HIDA, which is a little bit of a long title, but basically means anything supply chain from a policy or an issue perspective, and working with the administration on our goals are all kind of under my purview.
Wonderful, thanks. As you know, we've had some of our most challenging moments as professionals in the last 2 years. We've been talking about our global supply chain challenges, and we know you're talking about it every day too. We're all aware of how real this is right now. In our medical business at Cardinal Health, we have a unique and important responsibility as both a distributor and a medical products company. We are uniquely positioned to be a strategic partner to help the market and our customers navigate the evolving COVID environment and make informed decisions for the future. A lot like HIDA, our leadership team has been very mindful about focusing our efforts on what we can change and improve and trying to turn these challenges into opportunities to learn and grow. I'm really looking forward to hearing some of your thoughts on the current challenges and hearing more about how health systems, as well as manufacturers and distributors like us, can better partner to solve for these issues. So with that, let's start with some questions. So would you be able to tell me a little bit about who HIDA represents?
Absolutely. So for folks who might not be familiar with HIDA, we're the Health Industry Distributors Association. So we are the national trade association for medical product distributors like Cardinal. We've got about 110 distributor members, and they run the gamut. We're serving hospitals and physician offices, nursing homes, or even delivering to folks' home and home care agencies as well. Between our 110 companies, there are 500 distribution centers across the country. They manage 76 million square feet of warehouse space. And like I said, and I'm sure folks on the phone and are listening and watching us know, it is everything from gowns and gloves to gauze and lab equipment and supplies, things that you need for essential care, but things that you also need during a public health emergency. So I'm proud of our members like Cardinal and how everybody came together last year and worked hard. And we delivered 51 billion units of PPE to hospitals and providers last year. And I have no doubt if we had had 51 billion more units of PPE, we would have been able to deliver those as well. So I'm super proud of what our members have done during COVID. And speaking of our members, I think it would be helpful for your customers to know, as we tackle new issues like transportation, which I know is what we're going to talk about today, we really depend on our members and their subject matter expertise, especially for new issues like transportation. It's not something that HIDA's worked on in the past, but transportation has truly become a healthcare issue this year. We have a shipping work group that Cardinal is the co-chair of, and that has been incredibly instrumental in guiding our work with the White House and helping us develop policies and solutions with some of our work with the ports. And you guys have been with us every step of the way, so it is much appreciated. It has been absolutely instrumental.
Great, thanks, Linda. What is HIDA hearing from members about the transportation challenges that we're seeing today, including what we're seeing specifically at the ports?
It's almost like, what aren't we hearing? I feel like we are hearing about it more and more every day. I know everybody's probably seeing all the headlines, and it's everything. It's the ports, it's the rails, it's the truck, it's the driver shortage, it's the equipment shortage, which really, in a nutshell, means it's not simple. This is we think healthcare is complicated. Our intermodal transportation system is incredibly complicated as well. That's going to take some time to figure it out. And it's going to take all of us working together and rolling up our sleeves. But we did a quick survey of some of our members, so to maybe paint a picture for folks who are listening and watching. We are facing about 38 days on average of delay from across the whole transportation system. So that's anchored at the ports all the way through, whether it's rail or truck, getting to our members' hands and getting into healthcare providers' hands. That's huge when you put that into the fact of Thanksgiving's around the corner. If something was coming into anchor now, you would very likely not get it to the new year. And it's not acceptable. We've not been in a situation like that before. So it kind of goes back to it's not simple. It is going to take a while, and it's impacting the entire transportation system. We rely on transportation as a healthcare supply chain to be reliable and predictable, and it's not happening right now, and it's impacting everything. I think the other key thing for me that I really learned is it is all medical supplies. It is not just one item or another, depending on the market you serve, the types of products that you need, that to serve your customers every day. Everything is critical. Everything is essential to care, or it is only going to escalate for future problems. And people are going to end up in the emergency room if we don't get them the care that they need and the treatment they need. And I think that's a message we've been taking to policymakers, that you can't prioritize within healthcare. You've got to prioritize all medical supplies and equipment. I think that message has been heard and recognized, because we don't want to create more bottlenecks. We want to be able to expedite medical supplies, and we need all of them.
Yeah, totally agree. And I know you and I spend a lot of time talking about policy solutions. Could you talk a little bit about where HIDA is advocating and weighing in with government officials?
Sure. And we do talk about this a lot. It's, I think, our favorite topic of conversation recently. So like I said before, there's no question transportation is a healthcare issue now. And I think from HIDA's perspective, as we learn from our members like yourselves and the other folks that are part of our shipping work group, is a couple things: that aligning transportation 24/7 to support healthcare, especially during a public health emergency, is one thing we can think about. And I'm sure a lot of folks who are listening, there was an announcement recently about that. That's something that HIDA recommended over the summer with the input of our members. And that's something that's coming into play in implementation, with the ports announcing 24/7. And I hope that kind of carries through the rest of the transportation system. The second concept that we've really been talking about is a fast pass. And it's some way that we can flag medical supply containers so that everybody across the transportation system knows they're critical, can flag them and get them to the front of the line and expedite them. So basically, think about it as Disney, right? Everybody knows about getting to the front of the line. We want medical supplies to get to the front of the line. And it's got to be something that can be pulled through the entire transportation system. It can't just be recognized by one mode and not another. So that fast pass concept is something we actually just announced a little bit of 2 pilots that we've got going with the West Coast ports. We just announced this yesterday, actually, so this was perfect timing, and I have my fingers crossed that we'll have some successes to share with people. But again, this is a small step. It's with a couple ports and with a few of our members to test flagging those containers and expediting them through the ports. But that still means rail and truck and equipment issues. So there are other things behind it that we are going to roll up our sleeves and keep working on. This is just kind of one step. We need more ports involved too. There's more delays at Savannah and at New York. But again, we're super proud of the fact that our members came together, that the ports were willing to sit down and talk to us. And we are going to start piloting this week.
Oh, that's great. Can you talk a little bit about how you're working directly with the administration and how health systems can advocate for changes as well?
Sure. We've been talking to probably federal agencies that I didn't even always talk to because of transportation. When you think about Department of Transportation, it's not something HIDA's traditionally worked with, but we are talking to them. We talked to the Port Envoy, John Bakari, on a regular basis. We talked to HHS, obviously. We talked to the White House and their Supply Chain Disruption Task Force. Talk a lot to the Federal Maritime Commission, who's really been key in helping connect us with different ports and folks who can help make a difference. So I think those conversations have gone really well. I think they are well aware of our pilot that we just announced. They are wanting to be kept apprised. They are equally as hopeful and interested in its success. And then I think we can take that success and build from there, both to other ports, but also to the rail and to the truck. So it's been a lot of conversations. I think though what my big takeaway is that there's been so much willingness to have those conversations. There's been a lot of recognition that yes, Christmas is important, as we've all read in the headlines, but medical supplies are critical. And I've not heard any pushback or concerns of any kind about our work to expedite medical supplies. In fact, it's all been very supportive. And so I think, what's come out of all of those conversations is, I think, a lot of willingness and positive energy to trying to come up with some solutions.
Oh, that's great, Linda. And I think our health systems talking about the prioritization for medical products and how important it is would be really helpful as well. So appreciate your ongoing engagement on that.
Absolutely. I think the more healthcare providers can lend their voice to that, and you asked me that, and I didn't quite get to that part of the question. So like hospitals, every member of Congress has a hospital practically in their community, or a senator, or weighing in with your policymakers about the important work that we're doing, and the pilot that we've got going, and that the supply chain, the healthcare supply chain and the transportation system are trying to work together. Anything from a healthcare provider perspective, your voice is so critical. Policymakers pay attention. They want to make sure people in their communities are getting the care they need. And so I think lending voices to that and supporting that, and the need to expedite all medical supplies so that care can happen, is absolutely crucial. I would love all the hospitals to weigh in.
Yeah, that's great. So tell me a little bit about what you think the future looks like for our healthcare supply chain. What's the long-term situation?
So this is where I have to get out my crystal ball, right? Which is incredibly cloudy at the moment. I think that the bad news is this is long-term. This is not going away anytime soon. A lot of experts are predicting well into next year and beyond. Even it could go well into 2023. And I think even beyond that, and that all kind of depends on how these solutions play out, and how we're all able to work together. But I don't think this is something that is, there is no magic silver bullet that is going to change one piece. The only thing we can do is what I've always found: when you have a problem that is this big and big, complicated, pick one thing to work on, which is what we did with the West Coast ports, to start getting some traction and some pilots. And then you got to grow it from there. People then want to get engaged. They see some initial successes. So while the bad news is this is a long-term issue and a long-term problem, the good news, like I mentioned, is I think there's a lot of people willing to come to the table and roll up their sleeves. So
yeah, I'm going to take us all needing to work together on the solution.
I think so. Absolutely.
As we wrap up, can you tell me a little bit about what your biggest priority is right now?
I'm going to give you a short-term priority and a long-term priority. So my short-term priority, given that we just announced this initiative with the West Coast ports, is to make sure this is as successful as possible. I think anytime you can show some momentum and some success just helps you get more partners to the table, helps it kind of get on a momentum of its own even, and can kind of spread organically in terms of the solution and getting others involved. So short term, trying to show that there is support and success with these pilots, I think is critical. But I think then that helps us build to the long term, which it's a long-term problem. It's going to need a long-term solution, and we need something permanent. We need that fast pass sort of system for critical cargo, whatever the critical cargo is. It's healthcare right now. It might be something different in 5 years that needs to get to the front of the line in the ports, in 5 years from now. But we can be the ones that help set up that program and set up that fast pass and that recognition for the long term, so that we are not in this situation again. And what you said earlier, Rebecca, about looking back and learning and making sure we prevent things going forward. This is our opportunity to do that, and work with the transportation system. And then there was, I'm sure folks saw, there was a bipartisan transportation infrastructure package that was just passed and signed into a law. We are going to take some time and look through that. There's lots of new funding. There's lots of new initiatives, some new offices being even set up at Department of Transportation. That could be some opportunities for us to engage to cement that long-term policy solution that I was just talking about. So I think lots of work to do.
Thank you so much for sharing your time and your expertise with us, Linda. I really appreciate HIDA's leadership on this issue, and I'm encouraged by the steps that have been taken recently around the fast pass system, but completely agree. This is going to take all of us working together and looking both at short-term solutions, but then also to the future to try to prevent this from happening again. So it's our hope that we can continue to partner and learn and grow together as we come out of this onto the other side of the pandemic. But thank you for your time today, and look forward to all of our continued work together in the future.
Absolutely. Thanks so much for having me. You guys are great partners as always. And for the last word for our hospitals that are listening, I'd love for you guys to get involved and lend your voice as well. We'll take all the help we can get.
Thank you so much.
Thanks.